Okay, it's my pleasure to introduce Dr. Peikert, who did his medical training in Germany, followed by his internal medicine residency at Cleveland Clinic. Then he stayed there for a while and did his postdoc in cancer biology at Cleveland Clinic before coming to Mayo, Rochester, where he did his pulmonary critical care fellowship and then joined the staff. And he and I had a chance to work together in pulmonary until I moved here. So Dr. Peikert's interests are vasculitis, immunotherapy, and lung cancer, and he gives an awesome talk on mesothelioma. So welcome, Tobias.
Thank you very much. And yeah, first of all, thank you for getting me out of Rochester. I put these pictures in there. That was actually yesterday morning before I drove to work. So it was pretty cold and snow had fallen. So I always appreciate to get to Arizona. And so with this, we'll start kind of another whirlwind tour of a disease that's much more rare than your garden variety lung cancer. So these are my disclosures. I wanted to put in a pitch initially for this review paper, which was published earlier this year in the Journal of Thoracic Oncology, and give some credit to Amanda McCambridge, one of our fellows who really was instrumental in putting this together. So first of all, a few words about the epidemiology. As I'm sure most of you in the room are well aware of, the epidemiology of mesothelioma is very closely linked to asbestos exposure. And indeed, the disease occurs typically with a latency of about 20 to 40 years after asbestos exposure. And given the governmental regulations of asbestos, it was actually expected that the incidence of mesothelioma would start to decrease by now. Nevertheless, based on data that was published last year, while the demographics of mesothelioma remain relatively constant, it is still a disease of mostly elderly white men. The frequency, the incidence of mesothelioma really has not shown this decrease yet. So between 1999 and 2015, the number of mesothelioma cases has remained constant, if not gone up, based on the statistical analysis of this data. And this is the map of the distribution of the disease, kind of linking with known occupational exposures as well as environmental exposures within the United States. Besides asbestos, there's also other risk factors for mesothelioma. One other risk factor that's gaining more attention is erionite, which is another naturally occurring fibrous mineral. That was first described in the Cappadocia area of Turkey, where an increased frequency of mesothelioma has been associated with this. Nevertheless, it's not only a problem in Turkey, and these erionite formations are also present in the United States, and I will show you a little bit more data about this. Radiation is also a risk factor for the development of mesothelioma, especially if it occurred early in life. Hodgkin's disease during childhood and adolescence is typically the scenario when people develop mesothelioma later.